Welcome to the December Coffee with a Clinician. I'm Clayton Powers, and I'll be facilitating this series. I'm a doctor of physical therapy specializing in the care of individuals with complex health conditions, and I'm also the education liaison at BHC. Before we begin, we want to thank the donors whose support makes our community programs like this possible. For this session, Amy Mooney will present on pacing for holidays and special events. And following her presentation, we'll answer questions that participants have written in the Q&A feature. As a reminder, we cannot provide medical advice. So I'm super excited to present our panelists. Amy Mooney is a close colleague of mine. She's an occupational therapist and mother to a young woman who has had severe ME/CFS for several years. And Melinda Maxwell is also a close colleague. She's a physical therapist who recently received her transitional Doctor of Physical Therapy degree. She was diagnosed with ME/CFS and POTS in 2001 and will help answer questions related to today's topic.
Hello, everyone. I am so honored to be here. I really appreciate being able to talk on this topic because I know firsthand, as a parent, how difficult it can be to go through holidays. I know the struggles that my daughter has gone through for trying to participate as much as she can, and it has looked different over the course of years of her illness. So this is just a brief outline of some ideas that I've had and tried to integrate them into some of my occupational therapy framework and my kind of nerding out on activity analysis. So this is kind of the basic outline of what I want to cover in this very short presentation. I'm looking at it as holidays and also special events because not everything revolves around religious holidays, and some events such as birthdays or funerals or graduations are just as important that need to be helped and to be celebrated or acknowledged in your life process. So I want to look for kind of mapping out activity, rest, supports, any adjustments you need for planning for these events, and also giving a framework for you to be able to anticipate what kind of rest you need, what kind of symptoms that start to present because of specific activities, and then how to communicate your needs, your realistic expectations to your friends and family. So, why are holidays? Why are events so hard for people with ME, for post-exertional malaise? I look at this as being a piling up of a lot of events, a lot of things on the to-do list that are out of the normal daily expectations. So I look at that stacking of activities. I look at this as being a physical, social, emotional, and extremely sensory stimulating time of your day, week, month. I also look at the pressure for people to feel to have to push through this event and finish it to the end. The routines and sleep that you have tried so hard to establish in your day-to-day living often gets thrown out the window. And then looking at what kind of travel is involved or what even change of rooms look like for your immediate environment. What weather, there might be times of the year that are more difficult to handle certain holidays, events, that you come to realize, is fall or winter more difficult for you? And then looking at what people are around you. Is it just a couple people, or are they crowds that you're trying to navigate? This all adds to the unpredictability that really changes up your schedule or your routine. And then also really acknowledging how emotionally heavy this time can be. These can be happy feelings, or they can be very stressful and distressing emotions that are kind of wrapped up in this big package. Just looking at a holiday, I really want to break it down into smaller activities. And these can be just because we're at the time of Hanukkah and we're at the time of Christmas, looking at what kind of preparations you are doing over the course of the month or over the course of the fall. There probably have been decorating or shopping or meal plannings that have happened. And for this, I know that this can be for a person that is more severe. These aren't necessarily on your list of activities, but in the bigger picture of what's happening around you, this preparation can be overwhelming. It can be taxing. Also, the connections or the engagements with people, friends. This can be just general conversations or even texts that happen that are little small events that, receiving a greeting card is out of your normal activity of that particular day. Celebration is also another type of activity. This can be participating in family or the cultural traditions of what you encounter, such as opening gifts or playing games, singing, sharing news, sharing meals, sharing events of the season for that family structure. So those I'll get into a little bit more detail, but I just want to be able to acknowledge that these type of events, they accumulate, and I want to be able to look at them as small individual units so that we can do more analysis for what this means and what your priorities are. So those are more of the mic on the bigger level of looking at things. And now I want to get into the more minute, looking at identifying what of those activities that I just went through, what is the golden nugget? Decorating and preparation might not be very prioritized for you. It's not as important for you to be engaged in. So I want to look at what is of this holiday event of particular, let's pick Christmas or Hanukkah. What is it about that holiday that is going to be the most meaningful for you? Is it looking at the social interactions? Is it to have special meals or treats? I want to look at what this smaller activity is that holds the meaning. I want to look at that golden nugget, I call it, because I want to preserve that piece of that activity or that holiday that is going to bring you the most meaningful peace or joy or any kind of emotion. That's what I'm trying to get at. So in order to get that nugget, I've tried to look at this as a framework. Looking at it, analyzing activities such as opening presents, or maybe it's going to be having a conversation with a relative that you don't get to see very often. Or it may be, like last night, I went to one of my children's choir concerts. That might be a piece of that you are really valuing for your celebration or a moment. While I was at that choir concert, I was thinking how many people in this audience gave up a lot of other activities just so that they could be in this event. They may not have had necessarily restricted a lot of activity, but they may have long COVID. They may have ME that are sitting here trying to prioritize this choir event and looking at the types of stressors that are influencing the effort that goes into this event. For example, for somebody that has more mild symptoms to attend a choir concert, what was the time that was involved in this event? What time of day was it? Where was it during the week? How much time did it take to do this activity? In the next few slides, I'm going to go through these stressors to give you a little bit more example of these type of stressors so that activity analysis can be a little bit more kind of built in, giving you a little bit more of a framework so that you can start analyzing some of your golden nuggets for your holiday event or a special event such as a birthday. For those of you that are more severe, that have symptoms that are absolutely not going to be community engagement, but more on just surviving, getting food, getting access to different things, different parts of your daily living. I hope to acknowledge those type of stressors too, but I want you to think about, during a celebration like a birthday, when during your month of a birthday is best for you to start celebrating, or not even necessarily celebrating, but at acknowledging that it is a birthday or it is something that is important to you. So I would like to go on to the next slides where I can break this down a little bit more detailed so that we can get a few more examples. So like I said, for example, attending a concert, attending something that is completely outside of your normal activities. It's a child's event that you want to participate in. Looking at what time of day this is happening. Is it at a time of day that you have absolutely no decision? You cannot change it. Then how long can you attend? Do you look at the schedule ahead of time and choose the very first part of the concert, or do you go at the end when you know that that's the part that your child is going to be most seen or heard, to be part of this concert? Do you go for just 10 minutes or do you go for the whole event? Frequency. That's harder for this type of event because this is just a one-time deal, but just looking at how often it might happen or the time between activity and rest is something to consider. How much rest do you need before you leave your home? And then how does it sequence with other activities of that day? Did you take a shower in the morning and now you plan on attending in the evening? Well, then maybe it might be important to change that you do the shower or some sort of grooming the day before, or skip it altogether just so that you know that this particular event is going to be a heavy physical activity, is going to be heavy and sensory, that you might need to spread it out and schedule at a different time. This also looking at something from somebody that is more severe. Maybe it's having a conversation with a loved one. It's a birthday that you want to acknowledge. When during the day can this conversation happen? How long can it happen? It's maybe only a 5-minute event or conversation. It may be asynchronous. It may be through text, so you're not having it live. So I just want to look at time as being some part of the component that is flexible. You can change things around to meet it best for your needs. And this is where I also, try to look at how does that event fit into your schedule for the day and also for the month? How does it play with other things that are happening on your schedule? So this is just an example of a visual that I like to use just to be able to kind of plan things out for you to see where it's going to fit on your day and in a bigger process. And then looking at the physical stressors, how does your biofeedback, how does your heart rate, your blood pressure, your breathing, your dizziness, what are those type of experiences? How are they influencing this particular activity? Being upright in a chair is possibly going to be a difficult way for you to tolerate this activity. So looking at where this happens, what your body mechanics is, and then the overall positioning of your body for this activity. And then another form of stressor is cognitive. Perception is, what is going on in the room? How much am I needing to pay attention at this event? If you're having a conversation with a loved one, it's in a quiet room. How much do I need to pay attention to the details? Are things happening in the room or movements or patterns on the curtains? Are they directing my attention and my overall cognition away from the language that is being communicated to me? How can I simplify those type of stressors so that I can have the most attuned focus on the information that's being shared? And this also can go into, what's processing. What is this conversation about? Is this something that's going to be a heavier conversation, or is this something that's going to be light material that is not difficult to take in and process? So sometimes giving clues to your conversation colleague here or your loved one, let's keep it light and let's keep it emotionally a light conversation so that we don't have to go deeper in and I don't have to really manage and manipulate that information in my brain so I can keep things a little bit lighter for processing. And then memory, remembering the details of conversations. Sensory stressors. And this, I want to jump back to the just the vision of, for people that are going to be out in the community for a holiday event or go to a restaurant or to another family member's home. Sensory is very important to consider. What are the lights and decorations? What's visually stimulating? What's auditorily stimulating? What is there background music that is happening? And I'm having to listen and filter a lot of noises or other conversations in the room. Smells, candles, cooking smells. Are a lot of people wearing perfumes? That is a distraction. Those are all sensory exertions that can be controlled by changing the type of environment that you are in. What tastes, what textures are you experiencing with foods? Tactile, what is touching you? Are people touching you? Are you getting a lot of feedback through your skin? Vestibular movements, bending, turning, travel if you're in the car. Proprioception, having to reach and move. And then interoception is what's going on internally that your body is having to process. Are you hungry? Are you having internal vibrations? All of those things, all of those sensory stimulations are exertion. And if you can eliminate some of those sensory triggers or stressors, that decreases the exertion of the activity. So, for example, being in a smaller setting may cut down on background noises or lights and different smells. So those are ways that you can control a little bit of your sensory stimulation when you are engaging in community events or opportunities. And then the emotional stressor. Not all emotions are distressful or bad stress. We can also have good stress, but those are exertions. And I think when people have excitement and they're nervous about things or they have joy, that can also be exertion. Thinking about seeing somebody that you haven't seen for a while, that is exertion. And I want to acknowledge that, yes, we have so much wrapped up in a holiday or a special event. Some of it we can think of as being joy. And just as much as we want to be happy and give ourselves pleasure, that can also really be exertional. On the other side, that distressful or bad stress, there's so much wrapped up into the holidays that these are the heavier landmines that I think that people, by remembering some of the holidays of the past, can often go into deeper, darker feelings that can be very overwhelming. And I think that if we see this as exertion, we can build up strategies to help us manage and get through some of these events with some more support and pulling in resources that might be necessary. And some of these emotional stressors can be trying to just get everything all done, do it all. It might be that now that you realize that the holiday is coming up or the special event is happening, that you want to look happy, you want to tell people that you're doing well enough. Often people, their first question is, "Hey, how are you doing?" And that's a really hard thing to answer. And sometimes kind of putting up the boundary to say, "I am not giving a medical update at this part of my day. Things are going on. I'll fill you in later." So giving yourself some ways out for handling these emotional stressors that may creep up, that are either times of happiness or where you hope that you could find some joy, but then also times that are exhausting and extra work for you. And then lastly, this environmental stressor. We look at what the weather is like. It's changing. There's snow one day and rain the other day, and maybe a barometric pressure change. These all add up on our body. Our bodies are full of fluids and they changed as the weather changes. So just knowing that you didn't even do anything, but the weather may have, and your body just went through a change, and that is exertion. You're exposed to a lot of people and they might be sick. So just that alone is your body trying to fight off things that you're not even aware of. Chemical exposures, cleaners, somebody, cleaned their house ready for guests. Well, now you enter and you can feel right away that your mast cell activation is kicking up. These are exertions. Mold, dust, pollution, the crowd size and the layout of space. If this room is open, it's a big space. You're now navigating this visual or this auditory piece. So this is part of the environment that sometimes we don't necessarily recognize, but they are absolutely exertion related. So these are some things that I want to just highlight, and I'm not going to go through all of it, but I just wanted to say for people that are on the more mild or moderate ME, there are different considerations than for somebody that is severe. And these may be looking at what time of day you're going to plan your task and what size of the chunks that you need of rest in between. And these might be micro rests. So it might not be a full isolation or multi-day isolation, but it is definitely still adding in micro rest, driving someplace and then taking 20 minutes in the car before you leave to go into a different building. The physical, really looking at your energy saving strategies. Can you sit or recline when necessary? You do not need to be sitting up to have an interaction with a loved one. You can easily be laying down. And so going through these type of suggestions may help you look at how you can eliminate exertion you're planning to engage in. And so then for individuals that are moderate or severe, we're looking at just keeping the activities to very, very short windows, to scheduling your highest capacity time. What time of day or week do you have the most capacity? And I know that this is mainly looking at just survival, getting through your basic activities of daily living with maybe one event for the week, that may be, looking at greeting cards or looking at social media just to see that your family members are celebrating, just so that you can feel like you are engaged. So this would be keeping to your basic ADLs and adding minimal activities where you feel that's the golden nugget. Is it having a social interaction with a loved one? That's what you are going to prioritize. You are going to keep your physical exertions, your cognitive exertions at your baseline so that you are not exceeding your threshold and moving beyond your capacity. And then again, looking at rest, how for somebody that is more mild to also somebody that is more severe, how to keep your rest as a therapeutic intervention. This is not something that you are going to be taking lightly. You need to be active. You need to be planning. It is something that needs to be predicted. It is non-negotiable. You keep it as bubble wrapped as you possibly can. It is vital to keeping your routine and your schedule as consistent as possible. And looking that crashing is not the time that you are actually resting. Crashing is getting through those intense symptoms so that your system can get back into baseline. Once you are back closer to your baseline, then you begin aggressively resting for your prioritized next activity. So I want to look at rest as being very, very intentional and very planned. It is to settle your body into its baseline so that you can then plan for your next activity. And doing this is looking at, using autonomic nervous system calming strategies. It is if your body feels unregulated, how do you regulate it? Is it temperature that is fluctuating? Using a warm heating blanket or putting an ice pack at the back of your neck to be calming your autonomic nervous system. It may be using a weighted blanket or asking your caregiver to give your joints movement so that you can passively get proprioception or information into the joints to help plan or coordinate your body so it feels part of yourself again. And then also looking at reducing your sensory input, take away vision, take away hearing, calming your body so that it can be starting to regulate that nervous system and quiet your body and lower the environmental stimulation, turning off fans, turning off background noises or lights so that you have a quiet environment. And then getting your body into a very supported, protective position, maybe raising your feet above your heart level so that you get more blood back to your brain and back circulating easier. So using those positions that you know bring your body rest. And then finally staying hydrating, keeping your electrolytes and keeping your body well hydrated. That helps increase the blood volume of your circulatory system so that your heart is not pumping as aggressively. And then keeping your body warm or cool, whatever feels appropriate for your rest position. And then wrapping up, like I said, that these are small activities. It is not big moments. We need to find what that golden nugget is for your meaningful prioritized events. Each activity has time, physical, cognitive, sensory, emotional, and environmental demands. Those are stressors. Those are exertion. And I want to be able to pull them apart so that you can see how taking away some of those stressors make things more available to you. Planning, prioritizing, and pacing can make things slightly more doable. But most importantly, it's to bring a sliver of meaning and joy, peace, anything back into your day so that you have control. You can have more control over the outcome of your activities. So finally, you deserve to participate in any way possible in these events, but it's to protect your health and so that you can have a moment of peace with these activities.
Amy, thank you for providing a great overview of how to handle holidays and special events. We have a lot of great questions, and so I want to be able to get to some of the discussion. One of the things that you highlighted is that it takes a lot of planning and that multiple things can contribute to post-exertional malaise and worsening of symptoms. And so it can be a lot of planning and effort ahead of time, which can be hard because that also uses some energy. And so, how do you help people with planning so that it's not so stressful to plan ahead of time how to handle this?
I try to use like that outline, the kind of use a worksheet. I look at what type of activity is your body most capable to tolerate. And I almost look at like, like if you're in an ocean or a pool, what type of activity brings the water level over your head? And so I try to break it down as if it's something that's a physical activity, if you're already right up to the chin level with a physical activity and going to a different room in the house to open presents or to even sit and have a conversation with somebody, if you are already at chin level, going to another room is probably going to exceed your threshold. So I would say, you know, staying in your room would be better option. So let's plan for how you would have a conversation with a loved one. If that's your golden nugget, that's your most prioritized thing is to have social interaction with somebody. You crave that part of a special event. A cousin is coming and you want to see them. I would then plan what is the environment that would best suit your physical needs. It might be your bedroom. It might be in a recliner. It may be, in a chair, but it is positioned in a way that you are going to be most supported. And then I go through with my patients those strategies. Okay, we figured out what your physical exertion is going to be. What is your cognitive? What kind of topic can you talk about with this particular person? If there are some family dynamics, stay away from them. Let's keep it as light as you possibly can so that you can enjoy that conversation with somebody. So I go through those steps with the patient ahead of time so that we can start identifying. And this is something people can do on their own. They don't need me to help them go through these things. What is it about this particular activity that I want to get out of this, experience? I really, really want to eat a little bit of birthday cake. Okay, so it's not going to be at the table. It's going to be maybe in your bedroom. It's going to not be a full piece of cake because that's you normally can't handle that much sugar. Then you take smaller sections of it or you take it over time. So I try to really work them through these experiences and help them figure out ahead of time. These are your guidelines. These are your yeah, I don't want to say that you have to stick to it very, very strictly, but you really need to at least make sure that if you eat that whole piece of cake or you have a 20-minute conversation with somebody, it's going to be your choice. That's what you're choosing to
Yes,
do. I don't want
almost.
those to be
Yeah,
surprises.
yeah. It's like on your terms and creating the environment that you will tolerate best, and then inviting them to kind of be within those guidelines. That makes sense. Um, Melinda, one of the questions that I found really interesting in the chat was how do you handle the how are you question of how are you doing? Because often it can be hard when people, it's almost like you don't want to disappoint them with saying, like, things are still kind of rough, or I'm still uh, struggling with this. How do you manage that how are you doing question from family or friends?
Well, I think the biggest thing for me is I look at who's asking. Um, you know, um, if it's somebody who I know really, really wants to know a lot, then, I may say, I'll catch you up later. Um, but if it's just that social, hey, how are you type stuff, I just try to keep it light. I personally try to keep it light, and I try to throw it back to the other person as quickly as I can to get the attention off of me, because that in itself can be stressful. You know, they don't understand. And you may have rested up really well and you look good, and that's confusing. And, they don't see you in the bed for 2 weeks after the event. So I usually just, say, I'm doing okay, or I'm holding steady. And then I just change the subject, as quickly as I can. But I mean, it's a personal thing. I mean, I think people should do whatever they feel comfortable with. But again, I kind of consider who's asking most of the time.
That's really insightful to because some people don't necessarily want a long explanation. There's in the chat there's some great examples of saying like I'm here, or um, just some ways to make it less. For some people they don't want to all the details, but other people you probably feel more able to share what's actually going on.
Right.
And then Melinda, another question I had for you that came up in the Q&A is what are some signs that you notice or that people may notice that they're pushing beyond their energy envelope?
Mm, that's a great question. The more and more you practice and you learn about your energy envelopes, the better you become at noticing I like to call them whispers, that things are changing. And Amy mentioned that term interoception. So like for me, I noticed like the rhythm of my breath is changing. And that's usually one of the first signs. And, after practicing and crashing and learning and back and forth. That's what I came up with, that I know now if I feel that, then I probably should go in another room and lie down for a while. You get better at it the more you do. If you start having, if you start, your pulse starts racing, you start feeling dizzy and lightheaded, vibrating, pain, that's like, you've already gone too far, and it's, what do I do to lessen this? And again, that would be, try to get yourself flat in a dark room as soon as you can. But the key for me, and Amy asked me to mention this, because Amy's fantastic and we love Amy, but there's also a great online class for pacing, which Angela will put the link in. It was created by Bruce Campbell, and it's the MECFS self-help class. And they have a library that has lots of resources. And if you'll go under that, it has special event planning. And so, one thing that I always did when I was when I do those things is like I double up my energy before the activity that I'm going to do. And then I rest during the activity. And then I also rest more after it's over. And so if I'm doing that before the event, then hopefully I'll find myself less likely to be experiencing those symptoms that I've done too much. And for me also, when I plan to rest after an event, I feel like that because I planned it and I do need more rest, I don't look at that as a crash. I don't look at that as something that was out of control. I look at that as, I planned for this rest and I'm doing this rest, and I take that time to maybe reflect over what I did, and the good times I had and whatever. So just the after event rest planning to me makes me feel more in control.
That's great. Thank you. I know it can be everyone's whispers of PIM are unique. So everybody has different signs or symptoms that they start experiencing. One of the things that we'll often tell people is if you start becoming short of breath,
Right.
or you start noticing that the activity is becoming more difficult, that those are also signs that you might be overdoing it. But it can still be very challenging. Amy, I wanted to ask you, often also in the Q&A, people have brought up how isolating the holidays and special events can be, that there's a lot of loss and grief and sadness and that fear of missing out or feeling of being excluded. And how do you help people with that, or how do you think that um, how can we um, cope with that better?
Yeah, it's those are those are the landmines that sometimes you don't know until the event starts coming closer. If, for example, it might be a graduation that you can't attend, and now you feel like, this is something that I really wanted to go to. I know I'm missing out on my child's graduation or a funeral, and it's sad you're missing somebody. So emotions are absolutely exertion, and and the it has to be paced. I mean, it's the hardest thing to do is to pace your emotions. I think people have gotten really skilled at kind of putting things in buckets in their own kind of emotional baggage, more or less, that they know that if they go too deep, they're going to overdo themselves. And I saw somebody had written in there that crying is exhausting. I mean, to have to really cry, it is it's a full body experience. It's physical, it's emotional, it's sensory. Your mast cells are whacked out. Circulation, it's everything. It's so involved. So people try their best not to cry. And I think at times, which is horrible, but it's when you start feeling better, sometimes those explosions of emotions come through because you finally have a tiny bit of room and then it comes flooding out. And that's where I feel like those are the landmines that um, you didn't think that you were going to cry at some moment, and now it's seeping out. And I try to encourage my clients, my family, my everybody to be able to pinpoint it and say, I'm really angry about this, but I don't have the capacity to go there. But I'm not dismissing it. I just can't go deep. Or I need to hold on to that thought when I have just a different time of day, or if I have somebody else around me to help processing, or I want to yell and get this out of my body, get this emotion out. Um, but I want somebody else to hear it. So I want it to be known and seen that I'm really angry. So it may be calling that one friend and say, I need to vent. I don't want you to solve anything. I just want you to be present to hear it. So I think finding those opportunities to do it almost in a planned way, and it stinks that that's what has to happen for people that are struggling with exertion. I don't know how many other conditions have that much control over their emotions, but that's what I think pacing your emotional exertion can look like. Um, so yeah, working with mental health therapists is helpful, but it also is exertion to have to pull up those emotions on a schedule. So sometimes, even doing voice recordings or writing things down, or like I said, just having somebody hear you is a way to cope. But yeah, holidays are very, very triggering. They like I said before, they stack things, and that layering can make things very, very complex for emotional trauma. I mean, there's a lot of PTSD. It's not even just post-traumatic, it's chronic traumatic. And it's how many years can I miss this event? How many years do I miss my birthday? How many years, do I have to go through this? And that's where just trying to keep it a little bit, recognize that this is the trauma that happens, helps you at least feel validated. So yeah,
Thank you.
thank you for
No,
that
that's
question.
helpful.
Yeah.
Melinda, often this comes up a lot is how do I communicate with family, with friends, or even healthcare providers about my needs, or communicating with those who don't seem to understand or seem to care. What resources do you share, or how do you communicate with them in a way that helps them better understand?
Well, Bateman Horn has a lot of good information on their website now, uh, to share with family members, about what the illness is. I think that one of the hardest things for people to understand is the post-exertional malaise, or PIM. Um, you know, they don't see us when we are experiencing the repercussions of what we've gone through. That's why they call us the millions missing. I think that's the most baffling part to people about this illness. And I mean, there are resources, like I mentioned, Bateman Horn Center. Again, it depends on the person, again, as to how much detail I'm going to go into. Sometimes I just keep it, I just say I have this chronic illness and it affects my energy level, and I know what I need to do, and I'm just going to do what I need to do. And I just keep it light, especially if it's somebody new. It's like, how much energy do I want to expend with someone new, telling them about my issues, versus if it's a family member who's just not getting it, and I really need to have a conversation, where it's like, we need to do things differently if you want me to continue to be a part of this. And unfortunately, sometimes I've just had to let people go. People who just would not listen. And I would always be the one who would suffer the consequences, physically, emotionally, spiritually. I've just had to let those people go, and just cut off contact with them. And I know it's not possible to do that with everybody, but the people that I can do that with, I have actually done that. And it's for the best. And then sometimes there's a break from people, and then they come back into your lives and you're able to work through it. And, you have a chance to establish some boundaries, and it works, so again, just like the first question you asked me, it depends on the person.
Yeah, I agree. And it can also be helpful. I've heard to explain it in simple terms by saying, I have a severe neurologic condition,
Mm-hmm.
because people seem to be more sensitive to saying it's a neurologic
Right.
condition than using the term MECFS. That often goes over their head, but
Right.
yeah, it can be helpful to kind of simplify it by saying that. And then another one you had mentioned that you mentioned doubling up on your energy. And you, just to clarify, you said doubling up on your energy by resting preemptively. Is that right? Like that's how
Yeah.
you,
I'm sorry. Yeah, that's what I meant. If I didn't say that, I would double my rest time, before an activity. Like if I know that I have an event that I really want to go to, then like Amy mentioned, I am not going to take a shower on the day that I want to do this event, so it might be moving some things around, trying to clear my schedule more, not having other things on there, and just have more days of deep rest, light rest, which, light rest and deep rest, the true rest that's restorative and preemptive is, as Amy mentioned, trying to decrease all the sensory input you can, and lying flat, maybe have your legs elevated. What I was taught was it was okay to meditate. Some people find that too much, but for those who like to meditate, yes, but like when you start going to listening to podcasts and watching TV, that's more of that's not really rest. It's if you have orthostatic issues, then you are resting that part of your body, and you can get away with maybe watching a TV show or listening to a podcast. But But true deep rest is, silence, except for if you do follow a guided meditation or whatever. So I would usually double up on that, and reschedule anything that's possible so that I start to bank some energy. And also resting, like I mentioned before, during the activity. Um, some people go lay down in their car, or, go into, if you're at someone's house, go just lie down in their bedroom, take an eye patch with you and some earplugs and go lie down for a while. Um, I most people are fine just to let you do what you need to do, you know. And then the resting afterwards, doubling up on the rest after the activity too.
Love it. Thank you. Um, Amy, we probably have time for one or two more questions. One is, this gets asked a lot, which is, how do I find an occupational therapist or physical therapist or healthcare provider who knows about ME and can help?
I think the it's going to be hard to find somebody who knows as much as the Bateman Horn Center has out there. But I think finding an OT or PT, and I think a lot of regions, not everybody has access to an OT or a PT. They might have one. Is finding somebody that understands that this is not deconditioning, that there are systemic, multi-system abnormalities, and you need specific assistance for managing those domains. The like Melinda said, is it orthostatic? Is it what kinds of systems your body is really struggling with? What are your symptoms, more or less? Because those symptoms are interfering with with your life, and so by really targeting that this particular person is open to learning about post exertional malaise, and they are not going to be pushing like graded exercise or graded activity, even pacing activity. I want them to know that this is a really specific pacing for PEM way to look at care for you. So I would say, finding somebody that is open to receiving information and is willing to work with you on a very flexible schedule, because not every person can meet um, once a week or even, once a month. You need somebody that can be flexible and be able to take appointments as you need the support, and also somebody that can do it maybe remotely. So it's not going to be an in-person session, because you can't get yourself dressed and ready to be at a clinic or even have somebody in your home. So finding somebody that is open to seeing care in a different light.
Yeah, it can be challenging. I often find patient forums to be more helpful in finding someone than trying to look at finding them online just by searching. That can be really hard. And most insurance companies don't have a list of any or a directory of any providers who specialize in this. And even those who say they specialize in caring for ME/CFS, I know some physical therapists in my state who say that they treat ME/CFS, but then they give everybody who has ME/CFS an exercise protocol and the same protocol to everyone. So it can be challenging to actually vet and know that you're getting somebody who actually understands the best approach. I want to touch on one more thing, and that's um, often, since it's isolating and it can be hard when you're resting for long periods of time, um, you have to cope with boredom and lack of stimulation sometimes. And some patients will mention that it's helpful to listen to a story or movie that they know really well in the background, something that's not super stimulating or has a lot of stress in it, but having something that they're familiar with playing in the background to listen to. Melinda, how do you cope with boredom when you're resting?
Um, well, I actually myself, this what everybody's different, but for myself, if I am flat, then I'm able to do certain things. So I can actually watch a television show or be on my phone. Um, because for me, it's my symptoms are more um physical than cognitive. So I can do that, but for some people that would be a huge, that something that's really difficult. I think people just really have to experiment to find, what they can do. I've got three cats that like to pile up on me and just feeling the texture of their fur and listening to them purr. I mean, those are things that I do, and just naming the five senses, and then like I'm seeing, I hear, going through like the five senses is very helpful. Um, and just to, if I can, just to address that previous question that when you were asking Amy, I'm gonna do an online plug again. Bruce Campbell's online pacing class, um, cfsselfhelp.org. They do offer pacing classes. They have an introductory class. They have scholarships if finances are a problem. The class itself is, I think, about $20. And they have an expansive library. And if you get involved in a class, you also get to know people and you build a support system. And you learn about pacing, you learn about heart rate monitoring. You learn about your small envelopes, your large envelopes, things like that. So for people that are just not having any luck finding a PT or OT to work with them, this is an alternative.
Thank you. Thank you for sharing that. And thank you, Amy and Melinda, for joining, and all of those who joined us today. We hope to see you again for our next session on Wednesday, January 14th at 10 a.m. Mountain Time. We will send an email with the recording and associated resources at the end of the month. And please complete the brief survey if you have the energy that will pop up on your screen. And we look forward to being with you next month. Thanks.